Welcome to this special broadcast. I'm Mridusmita and today we are going to discuss on various problems related to anxiety. Well, as we all know that anxiety is a feeling of fear, dread and uneasiness. It might cause us to sweat, feel restless and tense, and not only this, it also have a rapid heartbeat. So in today's busy world, most of the people of any age group are suffering from anxiety. So to discuss on it, I have with me in the studio Dr. Mridusmita Neog, psychologist from Guwahati. So welcome to Northeast Live, Ms. Neog.
Thank you, Priya.
All right. Ms. Neog, first of all, tell our viewers, well, whenever a person feels restless or stressed, we directly say that, yes, you are having anxiety maybe. So first of all, tell our viewers, what is anxiety exactly?
See, anxiety is seen nowadays commonly in most of the people. So, when we talk about anxiety, anxiety basically involves lots of uneasiness, shortness of breath, and it's actually a emotion that triggers all our physical and psychological symptoms in us, eventually leads to fight and flight response. So that's what anxiety is all about. And when we say what are the symptoms that can be seen within us if a person is undergoing anxiety, it might be shortness of breath and unable to concentrate on certain tasks, sleeplessness. All these are quite obvious in us, and sometimes it goes unnoticed by us in our day-to-day life. So these symptoms are very important for us to keep in mind, and when it comes to anxiety actually.
So as you've already said that lack of sleep may be also one of the symptoms, but we don't notice it. It's very common.
Yes.
So, as anxiety is very common nowadays, so what are the main signs and symptoms of anxiety? So how would a person know that he or she, they are suffering from anxiety actually?
Like I mentioned, shortness of breath, palpitations, racing of heart, unable to concentrate on their day-to-day activities. Now, when I say anxieties, people usually confuse anxiety with stress. So, both anxiety and stress though are related, but stress is something different. Stress sometimes also helps us to accomplish a particular task. Stress is particularly of two types. It's eustress and distress. So, eustress is something that helps us in accomplishing our tasks, and it's not always bad. For example, tomorrow if I need to submit some assignment, so I will feel a kind of stress today, and that stress is helping me to accomplish the tasks. So that stress is good, and the distress that is creating a hindrance in accomplishment of the particular task. So now coming to anxiety, stress usually when there is stress, it goes away as the trigger goes away, but the anxiety it might happen and it will last longer even after trigger goes away.
Right. So, Ms. Neog, how to deal with anxiety or stress, if someone is having stress, restless, sweating, fast heartbeat, so how to deal with it?
So there are various techniques through which we can deal with it. First of all, we need to identify the trigger, why the person is getting that anxiety and what is the root cause of it. Whether the person is experiencing that anxiety because of financial loss, because of some trauma experience in the past, because of some loss of loved one, and so on. There might be lots of triggers, right? So we need to identify the trigger first, and what are the workable cope-up techniques for us. Everyone has a cope-up technique, so we need to work on us and see how we can deal with it. And if a person is unable to deal with it, then of course experts are there, psychologists, psychiatrists, all the mental health professionals are there. We are there to help them. So it's very important if a symptom goes out of control and you are unable to cope up with it, so it's very important to visit a mental health professional.
Right. So, so how are anxiety disorders, diagnosed?
Anxiety disorder, see, there are lots of tests involved in order to diagnose anxiety, and there are several physical conditions that also actually triggers this anxiety within us. Like when I say physical conditions, we can say like hypothyroidism, or a person is diagnosed with cancer, or there are lots of biological changes that happens, hormonal changes. So all this also can be one of the physical reasons that can trigger the anxiety. And there are physical examinations, there are psychological tests that involves, only after that we can say that the person is undergoing anxiety disorder.
Yes, so we will talk more on anxiety. We will also, Ms. Mridusmita Neog will also give few tips how to control anxiety immediately, isn't it? So now it's time for a very short break. Don't go anywhere, because I'll be right back with more tips on how to control anxiety immediately. So stay tuned to Northeast Live. Welcome back to this special broadcast. So as we are discussing on various problems related to anxiety, as Oliver mentioned, that today I have with me in the studio Dr. Mridusmita Neog. So Dr. Mridusmita Neog, what are the risk factors for anxiety disorders? Are there any risk factors for anxiety disorders?
Yes. If you are, if a person is undergoing certain physical illnesses, that will definitely trigger anxiety and other psychological issues within us. And if the person is experiencing some childhood traumas or traumas in the past, in adulthood also, that might be one of the risk factors. And yes, these are some of the points which we should actually keep in mind. If a person is having lots of stress in their day-to-day life and unable to handle it, and it goes to an extent when it hampers their day-to-day activities. So these are quite of the alarming signs when a person actually get it treated.
So by that time, they should consult a psychologist for proper medication and everything, and proper guidance.
And also we can see changes in their weight loss. In their weight, the person is losing weight, the person is gaining weight excessively in the last 2-3 months. So these are quite some of the symptoms.
Okay, that weight loss or weight gain also.
Yes, abnormal weight gain, abnormal
behavior.
Irritability.
So, Ms. Neog, any tips on how to control anxiety immediately? If a person is in office or anywhere, so stress is very common nowadays. Everyone, we face stress every now and then. So, any tips on how to control the anxiety or stress immediately?
Yeah, like I said, stress is not always bad for us. To some extent, if it is helping us in accomplishing the task, that stress is good and it goes away as the trigger goes away. Okay. So if that stress lasts for longer, then we can say that it's quite alarming sign, then that is the distress. And longer the distress is there with us, it might slip into anxiety disorders. So like I mentioned that the first and foremost thing, we should identify the triggers, and some of the tips that can be worked anywhere is writing down your thoughts. What are the particular thoughts that is actually making you anxious?
Okay.
Whenever we are anxious, probably we are so much in the future, what will happen to me once I am there in the presentation. XYZ factors are involved, XYZ statements that are formed within us about our future. So those statements, if we write down in a copy, that will help us. And if we try to organize our day, I mean a proper.
So we need to plan our day
planner.
ahead. Okay.
Yeah. So in that way, that is helpful. And yes, mindfulness, it's quite workable anywhere. So we need to be mindful, and there is another 5, 4, 3, 2, 1 technique that we should actually practice.
So we should count backwards, right?
Not only count backwards, counting backwards is something else. So 5, 4, 3, 2, 1 technique is, for example, I would say that suppose you are over anxious at this point of time.
Yeah.
When a person is over anxious, we internalize everything. So in order to control that, we need to shift our attention to the present scenario. Right. So the 5, 4, 3, 2, 1 technique is you need to bring your attention to this particular room. What are the things available here? What are the things that you can feel in this room? So in that way this goes. 5 things that we can see in this room, 4 things that we feel, 3 things that we hear, 2 that we are getting the smell, and 1 that we are getting the taste. So basically it's the activation of all the sense organs, and it helps us to be in the present moment. So this 5, 4, 3, 2, 1 technique is quite workable in you are anywhere at any time. So this you can do. Then just this breathing exercise, deep breathing, that you can practice anywhere. That you can do. And yes, these are quite of the things. Basically being mindful about what you are doing, and one thing at a time. So it's always we become anxious because we take so much of thing upon us. We are stressed about the thing that we need to go and do back in our home. We need to suppose I need to meet someone, suppose I have to go somewhere, I have to do something. So everything I am thinking at the present moment, and eventually it's giving me the anxiety. Right. So if I will focus at the present moment I am here, so I will focus at this point of time. The next thing I will plan out things, but when I will think about it much. When I will be there at that point of time, I don't know how the situation will go. So it's always good for us when we are at the particular situation. It's good for us to deal there itself. It's I mean, like, it's of no use by being here thinking, taking all the pain within us. So in that way, if we try to incorporate all these things, all this habit actually consciously within us, that will be helpful.
So, you know, most importantly, what I've understood, like, you have to be in the present.
Yes.
We don't have to think about the past or the future. What will you go, like, what next we're gonna do? We don't have to think about it. So we have to think about the present, feel the presence. As you already said, 5, 4, 3, 2, 1. That's a very, you know, useful formula.
Yes.
I'm sure our viewers will be applying this formula 5, 4, 3, 2, 1, as Mridusmita Neog has very, you know, she has explained it very nicely. So yes, and now whenever our viewers or any one of us, you know, whoever feels stress or anxiety, I'm sure this 5, 4, 3, 2, 1 formula will definitely work. Alright, so now Mridusmita, now tell us, does anxiety also leads to anger issues?
Yes. Irritability is one of the symptoms of anxiety. A person becomes irritable or is angry because he is unable to manage his life in a way that he or she is planning, and because the person is so much overwhelmed because of this anxiety. So sometimes it goes out of the way, and the things that we usually don't notice during anxiety, all those things comes into our notice, and we react in a very negative way. So anxiety, yes, anger can be one of the symptoms of anxiety.
Okay. And you know, what are the early signs? Are there any early signs or symptoms of, you know, first stage of anxiety, something like that?
Not exactly first stage, but yes, some of the signs that we can see within us, and we should be actually careful with that. Like if I am experiencing sleepless nights for many days, right? Lots of fatigue, don't like to go to work, don't like to do a particular thing, frustrated, irritated, excessive weight loss, weight gain, then too much of fear, too much of worry about any situation all the time. So all these things, though it sounds like normal, but it's quite alarming at times. So we need to keep in mind when it goes out of our control and we are unable to handle that. So it's very important to consult our expert.
Okay. So is, you know, depression the next stage of anxiety, or, you know, how is anxiety and depression related?
Yeah. Anxiety and depression, though are different clinically, but both are comorbid. it coexists. So if a person is having depression for several reasons, the anxiety might get triggered there. And when I say anxiety, there are lots of anxiety, as we know, like generalized anxiety, social anxiety, phobias, right? Panic disorders, panic attacks. So one of the anxiety symptoms might get triggered if a person is under clinical depression, and vice versa. Because of I give you an example, it will help you to understand this in a better way. For example, a person is diagnosed with cancer. How the person will feel? First of all, diagnosing with cancer, the person will be in shock. It's a kind of trauma for the person to handle it, the news, when he or she has been diagnosed. And because of that ailment, the person day-to-day life might get impacted in certain way. And because the day-to-day life is getting impacted, the person is unable to function like he or she used to function previously. So that is creating a sense of guilt again within the person, and that guilt actually triggers the anxiety. So when the person is diagnosed with the particular condition, whatever the condition is, here we are taking the example of cancer. There are lots of ailments that we can see, right? So that symptoms first of all can develop depression, because the person is in a shock, in a state of denial, unable to understand, unable to take that particular thing that he or she is being diagnosed. And then later on, because that particular health condition is preventing him to accomplish or to function normally like he or she used to do, so that is also creating a sense of anxiety, triggering the anxiety. So it correlates. Here we say that anxiety, these are the psychosomatic form of disorders. Psycho means psychological disorders that manifest in our body, and vice versa. Somatopsyche, psycho form of disorders are also there. That means you are physically ill and it triggers your psychological disorders. So it's like that. It's comorbid.
So can anxiety can also raise someone's blood pressure?
Yes, yes. Yes, anxiety can raise our blood pressure. Blood pressure gets shoot up, and yes, because of hypothyroidism, anxiety also get triggers.
So thinking various about various problems at one time, is this also a sign of anxiety?
Yes. That's what I just mentioned, that one thing at a time. You need to be focused at one thing. If you are focusing here at the present moment, that will help you. And if you are taking, for example, after going from office, you need to go somewhere, you need to say perform something. You are having that anxiety from now on, right? So you are thinking that how I will perform there, what the people's reaction will be there regarding the performance, and as you are thinking it here, it is also creating a hindrance in your present tasks, and you will be experiencing all sort of symptoms: breathlessness, irritability, lots of fatigue might be, lack of concentration. So all this can be there. So that's why one thing at a time.
So my question to you now: can anxiety be cured permanently?
Anxiety, yes, if proper treatment is taken, it can be cured. But if it is not curable also, because why I am saying it is not curable at times, because I have seen patients in my entire journey, they discontinue their treatment.
Okay.
Not only, I am not saying that they need to keep visiting us, but whatever therapies they have learned, whatever the doctors, the physicians, the psychologists, the mental health professionals have instructed them, they discontinue it. So while they are discontinuing it, and with the passing of time, they become quite comfortable with that particular issue. And they feel that okay, this is now has become a part of my life. So that's why it again occurs, because of lack of management.
So so
Yeah.
we need to plan everything ahead. We need to take be at the present, note it
Yes.
down our problems. So these are some of the common tips,
Yes.
to for stress management at
Yes.
present. So, my last question to you now, Mridusmita. So, can you please tell our viewers very briefly about is anxiety can also be seen among children nowadays?
Yes, anxiety can be seen among children nowadays. Not only anxiety, other form of psychological disorders are also seen within children these days. Children are undergoing lots of pressure, they are under lots of stress. It might be the active stress, it might be the passive stress. By passive stress here I mean that there is unknowing competition going on among the parents also. So that stress has been shifted to the children, you know.
Okay.
So they are also in a sense of competition. Now the academics are so highly competitive, right? So they need to score well, they know
Yeah.
it. They are in a competition, but when the parents are also in a competition that you need to score well, your neighbor friend is scoring this, my colleague's son is scoring this, and you are not scoring well. So it's a kind of build up of stress. So lots of anxiety, lots of psychological disorders can be seen nowadays among the children also.
All right.
So my request to the parents, actually, it's very important to not to shift your stress, not to shift your expectations to your children, because they are already under lots of stress, and it's very important to become aware about all those things and get it treated the prior is the best.
All right, Ms. Mridusmita Neog, thank you so much for joining us this
Thank you,
afternoon.
Priya.
All right, so I hope this episode will be very insightful for all the viewers of Northeast Live, especially for those who are looking at solutions to beat stress. So that's all we have for now. Keep watching Northeast Live. Thanks for watching.